Hello everyone, my name is Crystal Callan and I will be presenting my nursing informatics paper. The topic of my paper is telemedicine's role in addressing access issues in the United States. Telemedicine is when medical services are provided via telecommunication technologies. Throughout the presentation and the paper, it will also be referred to as telehealth. It is used to support the patient and physician in distant sites to diagnose and treat. Telemedicine is mostly utilized in rural populations in the United States to supplement essential healthcare services. The purpose of this paper will be to highlight the role that telemedicine plays to address health disparities in rural populations in the United States in terms of what benefits, barriers, and reforms are needed to telemedicine. The first study that I would like to address is a study that was performed with mothers that were part of a telelactation program within Pennsylvania. The telelactation program, which can be considered a specialty service that some hospitals or local clinics might not be able to provide, was able to be provided via telehealth. It showed to have higher rates of breastfeeding compared to the traditional in-person programs, which shows that not only can rural communities get equal access of care, they can also sometimes even do better than those going into traditional programs, in-person programs. Also, during the study, another study that was conducted in Nebraska and Iowa with the management of type 1 diabetes. They were some of the people who were part of the study had an in-person endocrinologist, a traditional endocrinologist, and some did not. So both of those were compared and brought into the program. During the program, they used traditional telehealth visits, which is when the provider is located in a distant site and the patient is located in a local clinic with a synchronous visit, so they were able to see and have a conversation at the same time. Some of the results that were part of the study showed that there was a significant decline in A1C lab values in those participants that were part of the study, even those that already had in-person endocrinologists before the study. So another study that was taking place was at VA medical centers, but not in one location, but in multiple rural locations throughout the United States. It was a telesleep program that established access for patients requiring sleep apnea testing. And those that participated in the study reported ease of use and satisfaction with the care they were provided. They were having improved sleep quality as a result. Their other health concerns they felt like were addressed and their quality of life improved. Another study that was taking place was in Carolina. It was The Closer the Better, which talked about women's health needs. So providers might not be able to prescribe contraceptions or they don't know enough about it. So the access that these women were able to be empowered to receive was through telehealth. Also, they were able to do it without possibly any judgment, doing it in the comfort of their home or at a local clinic, but able to have that telehealth meeting without anyone knowing if they were doing anything that they felt that maybe the community was not a part of. When women stated an overall improvement in wellness, they felt that the contraception was a big component in making them feel that they were doing the best they can for their bodies and the best they can for their overall health and being in control of all of that. So through all these studies, I was able to condense down some of the key points that were found throughout most of the studies. I found that there was decreased travel time for the patients, which they felt was great because it didn't cost them as much to travel and just the amount of time it took to travel. Decreased cost of consultation. So consultation fees were reduced because it was on a telehealth model, which are normally don't take as long and they are just not, they're just more affordable than a traditional in-person visit. There was decreased wait times, especially when we keep receiving care from a specialist. They were able to receive care more quickly than those of traditional in-person visits. There was decreased number of missed visits, decreased number of hospital readmissions, and improved care consistency. So they were able to see the same provider over and over again, even if they were at a far distance. So maybe for them, going to a provider that was 6 hours away was a lot easier when it was through telehealth because they removed that 6-hour time frame of traveling and the amount of money it would cost. Overall, it just empowered the patients to be active participants in their care and being able to take hold of their health and overall wellness. Some of the barriers to telemedicine are expensive startup costs, which for local rural clinics, they might not have the money to start up a telehealth accessibility to have the patients come in and communicate with other doctors at maybe university hospitals, research hospitals, um, or also having patients have telehealth visits at home. It's the equipment that would need to be bought, and the startup costs are hard for a lot of clinics and a lot of doctors and providers to get. And also, urban environments might not be as willing to do telehealth visits. Licensing is also a barrier. If a provider is treating a patient in one state and then the patient is in another state, it's really difficult because then the provider would need like a license that is licensed in both states, an interstate license. But they're really talking about maybe communicating better, having more like less licensing barriers, especially after the pandemic. Privacy and confidentiality is another issue that was brought up a lot throughout most of the research. Patients are worried about being interrupted during their telehealth visit, their information being recorded without their knowledge, and the software just not being as safe. Patients provider technology literacy. So the providers and the patients both be able to have to know how to use that software, know how to use that technology. And really not many education programs teach telehealth and how to perform a telehealth visit, how to use that technology. So that's something I'll touch on later. Access to broadband internet. So maybe some rural populations might not have as much access as others. Throughout most of my studies, all the participants were able to have access to broadband internet. So there is access in some rural populations. And reimbursement costs like cross-state billing, having adequate payment scales, because a lot of providers rather have the in-person visits where they are getting the full amount of payment than doing the telehealth, which is not the same amount of reimbursement. So some of the reforms that need to be taken into account when talking about how to make telemedicine more accessible to patients who are in rural populations definitely has to come back to licensing. Licensing is a barrier that a lot of providers see that they can't treat other patients in other states. So they talk about having interstate licensing compact. There are some states that are part of that already. Then licensing based off physician's location, not just where the patient is located. TRICARE, which is a military insurance, does that. They base their license based off of the provider and not where the patient is located. The Equal Access to Care Act was brought in during the COVID-19 pandemic, which it was a bill to temporarily authorize healthcare providers who are physically located in a different state from the patient to treat that patient, which is similar to what TRICARE does. And then federal licensing was another option. So no states would have their own license, but there would be an overall federal license, which doesn't seem very plausible because states have established their licensing for many years, and they like to have that control over what their state standards are. In terms of like reimbursement and overcoming initial costs of starting up telehealth services, some things that need to be addressed is cross-state billing, not just in-state billing and in-state networks. So how can insurance companies overcome that hurdle? And maybe establishing a federal network so that patients, there isn't just state networks, but it would be a federal network of reimbursement. Also during the Coronavirus Aid, Relief, and Economic Securities Act, the CARES Act, during the COVID-19 pandemic, gave about $2 million in funding to providers to connect their services by telehealth to patients and to make everything more accessible to patients in their homes. Education is another thing that needs to be addressed. During a lot of healthcare providers aren't trained during their rotations, they aren't trained during their programs, how to communicate with patients over telehealth, how to use the technology, how to be technologically literate, how to display empathy through technology, how to assist their patients with any like troubleshooting, how to make sure that the patient feels comfortable, how to make sure the patient feels secure to share things over telehealth that they might not feel comfortable initially sharing, especially when it's like health sensitive information. So I think just having more of a program in place through lecture, through sim labs, and through just hands-on learning within local clinics, local hospitals. Privacy and confidentiality was something that needs to be reformed to make patients more comfortable and providers more comfortable. There can be HIPAA agreements that could be part of the software that is developed for telemedicine. So making sure that once you log on, you know that your access and you know that your information is secure as a patient. And making sure that the network is unable to be penetrated, unable to break through and record the information, making sure that that patient feels that they have the same experience as if they were in a office without having to go through all the difficulties and all the other things that can be beneficial to telehealth and helping people who are in rural populations receive the care that they deserve. So in terms of the relevance of how telemedicine is to the field of nursing, they go hand in hand, especially in light of the COVID-19 pandemic. Providers need to be proficient with telemedicine software. They need to know how to conduct a form of telemedicine visit. They need to know how to comfort the patient, instruct the patient on how to provide quality care to themselves and how to do follow-up appointments, how to receive their medications, answer all their questions, and make sure that they feel that all of their needs are being met and there is no barrier for the computer being able to know how to use everything. Um, and just touching upon once again how nurse and nurse practitioner programs need to establish training via lecture, sim lab, and clinical experience to be exposed on how to use these softwares. So the first time they're using it isn't on the job training, and they'll be able to have a leg up in those areas and be a better provider, especially in light of the COVID-19 pandemic. We know that telemedicine is a way to access and care for patients in rural populations and help bridge the gap with health disparities and make sure that everyone is receiving the care that they deserve. And I think that where we're going in nursing informatics is that we are going to be proficient in these things, especially as we grow in this field. Thank you everyone for viewing my presentation. On the next 2 pages is just some of my references if you'd like to go through any of the studies. They're really interesting and it's great to just have all of that. Thank you for watching, and if you have any questions, please let me know. Thank you.